Hey, what's up, everyone? It's Tony Davenport, Kinetic Touch Medical Massage and Neurologic Rehab. I'm in my office. I have some free time. You know, I have a tender spot on my low back. It's on the right side. It's not actually the low back. It's actually in the musculature, and part of it is from tight hamstrings. Of course, I'm standing, I'm kneeling, I'm lifting people, I'm doing things, so mine tighten up on me. You know, and obviously I'm a victim of, or not victim of, a culprit of not stretching when I should be. So I'm going to stretch right now. Take the opportunity to do that. So I'm going to use the pulse to assist me. I'm going to get a deeper stretch faster. So I already have it running. And so it's not turned up yet. So I'm going to put my hamstring, the belly of my hamstring, along there, try and get it centered on the crosshairs on my square pad. Then I'm going to use my resistive ankle band, not for exercise, but just to help hold my foot in place. So my length, pull toes back. My hand is pulling tension to rest at my knee. It's not a lot, but it is enough. So holding here, holding this position, I am going to actually release this for a moment to reach over to the pulse to start turning up the pulse so I can feel it into my hamstring. And I don't know if you can hear it or see my hamstring jumping. That's not me doing that. That is the pulse making me bounce, which is also making my hand move. What are we getting at here? You have two sensors on the muscle, every muscle, the Golgi apparatus, and the muscle spindles. You have other sensors, but we're going to focus on these two for the moment. The Golgi apparatus is at the end of each muscle, near the tendinous connection to the bone, and that tells the brain the stretch, the tension. That tells more of the tension that's on the muscle. The Golgi, the muscle spindle cells is like those of us who are old enough to know the coils from the telephone cord, that wraps around the muscle, the length of the muscle, and that tells the brain the stretch and the rate of change and stretch in the muscle tissue as well. So now the pulse is going through there, and there's a gentle, a passive contraction happening on the tissue, and that's going to help release and relax. So right now, just sitting in this position, I'm thoracic extended, right? And then I'm going to pull my toes back towards me. Lazy stretching is this, leg all out here. So now I'm going to pull toes back towards me, and I'm going to sit up nice and tall, and I'm already feeling something of a stretch. All I have to do is a slight anterior tilt of my pelvis, lean forward, and that's a stretch. I don't have to do, definitely we're not doing the rounded out back stuff and all of that. So what I'm doing right now is I'm grabbing the tube, the ankle tube, and I'm going to pull just to hold tension. So now I'm not muscularly contracting my tibialis anterior to dorsiflex my foot. I'm just holding here, and now I'm able to assist in maintaining the anterior tilting as I pull myself into this stretch, deepens it, and now I feel the pulse going through there. And immediately, so when you deepen the stretch, when you feel a stretch, it's a sensation. It's people can have some people say it's pain. Some people, I know I've had personal training clients that I don't want to stretch. It's painful. It's like because you're doing something wrong. Stretching shouldn't be painful. There's going to be a mild. You're going to get to the point of discomfort and back off just a little bit and hold that, and then we're going to work later. If you're not an advanced stretcher, then you're not going to achieve a huge range of motion. But that's a whole nother conversation. So now that I've achieved a stretch, I achieved the sensation where I feel I'm maxed out. If I go anymore, I'm going to start causing pain and discomfort. That now has subsided. First, that would be if I was just sitting there. If I was sitting here in this position on the ground without the pulse running, it would either take it longer to subside or it wouldn't subside at all. Usually stretching like this without using gravity to assist you is also, you don't create a permanent change in the length of the muscle over a period of time. Continuously, consecutively. So to do so, you have to somehow involve gravity and partial weight bearing positions, which is why yoga is so damn great, to achieve the deepening. Now I've done this. I'm dorsiflexing my toe. I've got my band pulling back. My hips are anteriorly tilted. My thoracic spine is extended. And the stretch I felt when I first started talking, once I got in position, is now gone. Now I can deepen it and feel and go a little bit more. So using the pulse device, using pulse alone, you can deepen a stretch on the muscle group, What is that going to do for my low back on the right side where I feel the pain? Now, granted, I broke my leg in February 2002. A nurse was able to catch that my left leg is 1 millimeter shorter than my right. This is also causing irritation on my right rear SI joint. So taking pressure out of the musculature as the way, your hamstrings insert onto the ischial tuberosity, which is the low hook hanging section of your hip bone on each side. So if one of their jobs is to destabilize knee extension, decelerate, eccentrically load to slow down knee extension. That means if your knee hyperextends when you walk, or you hyperextend your knee when you're standing, that means you're disengaging your hamstrings. But if you engage them, then they're going to be working. So that's going to create tension in the muscle that doesn't get relieved. Therefore, you're going to have low back pain. And that's a strong contributor to low back pain in Americans, 90% of the workforce. Let's see, piriformis syndrome, sciatica. Yeah, they're interchangeable, but not really. Piriformis refers more to the muscle. Sciatica refers to the nerve. Either way, people have pain there. It radiates down the leg. It radiates into the low back. The quadratus lumborum goes from your 12th rib to the top of your iliac crest. That also gets pissed off, contributing to the low back tightness. And then if you look over my shoulder here, if you look at I'm going to kind of get the other guy out. If you look at that guy, the musculature, the muscular system, that whiteness that's in the back here, this piece right here, so right there, that big tendon, right? That's the thoracolumbar aponeurosis. That is a big sheet of tendon that anchors your latissimus dorsi. It's the origin of the latissimus dorsi. So, but it also anchors itself to your iliac crest. So that tightens the hell up too. Now, you have to really work hard to make a permanent change consecutively to keep that low back pain from happening. So all we're going to do is I'm going to hold this. I've been holding it for all this time we've been talking. The discomfort is completely gone. All I'm going to do is lean forward and deepen it some more. So now, instead of holding on to the band, the ankle strap, I can reach and grab my toe, and I'm just tilting myself forward, slouching my back to get to my toe. So again, and the length of the hamstrings will relieve tension off your low back. Now you can do it normally without the pulse. It just takes you longer to hold this position. The older we get, the longer we hold stretches. That came from the physical therapist that worked on me in 2002. I was 26 when I broke my leg. She was having me hold stretches on that leg for 5 minutes at a time. She said if I'd have been 46 at that time, she said the 5 minutes would have been 7 or 10 minutes at a time. Well, I'm 44 now, so here we are. Granted, my leg's not damaged, but the older we get, the longer you have to hold stretches, or the more repetitively. So you'll find people who are in their 60s, 70s, 50s, 60s, 70s doing morning stretch routines and evening stretch routines to keep the muscle tension loose and relieved around their body. So if not, it adds to musculoskeletal disorders, which are amongst the number one reasons why people call out from work, aside from being sick. So if you have any questions, feel free to reach me at tony@kinetictouchmedical.com. Again, that's tony@kinetictouchmedical.com. My new website is www.kinetictouchmedical.com. You can always respond or type comments on this post, or you can find my Instagram page, my YouTube channel, my Facebook page, my LinkedIn page, and send me a message. So you have ways of getting to me. By all means, ask questions. If you want to increase your flexibility and you're having trouble stretching and you don't like the way people work with you in stretching, because I've seen a whole lot of that over the years, hey, reach out to me. I can definitely help you find an easier, non-aggressive, non-invasive way to increase your range of motion and reduce the tension on the muscle groups.